Today we're going to learn about the posterior aspect and the lateral aspect of the larynx. We had discussed about the anterior aspect in the previous video. So let's begin with that. The first thing that is a leaf-like structure is epiglottis. And then this bone is a hyoid bone. Other thing that you will see on the posterior aspect superiorly is this ligament, which is between the hyoid bone, and this is a cartilage known as trapezial cartilage. So in between these two is a ligament known as a lateral thyrohyoid ligament, right? On both sides, here is the same trapezial cartilage, and this is hyoid bone. In between these two is a lateral thyrohyoid ligament. Now move down. These two have three cartilages, right? So the bigger one is arytenoid cartilage. Then here above it will be, at the tip of it will be carniculate cartilage, and at the tip of the carniculate cartilage you will have a cuneiform cartilage, but that is not visible, right? Now move ahead to this orange structure. Overall it is a thyroid gland, and you are seeing some blue color vein, and these are superior thyroid vein. Now we are left with some muscles. So these muscles are inferior constrictor. Then the muscle moving down are the longitudinal esophageal muscle, and the horizontal muscles are the cricopharyngeus part of the inferior constrictor muscle. So let's revise on the point that you will see on the posterior aspect of the larynx is the epiglottis, the leaf-like structure. The ligament between the hyoid bone and the trapezial cartilage is internal thyrohyoid ligament. You will see arytenoid cartilage, you will see carniculate cartilage, you will see a thyroid gland and a superior thyroid vein. And the muscles are the vertical moving downward are longitudinal esophageal muscle. The oblique ones are inferior constrictor, and the horizontal will be the cricopharyngeus part of the inferior constrictor muscle. So let's move ahead towards the lateral aspect. We have some points there. So this one is oral hyoid bone. We had studied on the anterior aspect that it is superior horn, okay, the lesser horn of the hyoid bone, and this hole is a greater horn of the hyoid bone. This projecting part we had now learned on the posterior aspect that this is the epiglottis. This is a membrane between the hyoid bone and the thyroid cartilage, and this is known as a thyrohyoid membrane. We will find out a notch in this membrane, and this is a notch for the superior laryngeal vessels and the internal branch of the superior laryngeal nerve. Moving downward, this is overall, you know, the thyroid gland. It is showing three types of arteries. The above one is superior thyroid artery, inferior thyroid artery, and thyroidema artery. And that's all about the lateral aspect. Let's revise what we will see on the lateral aspect. First thing is hyoid bone. Lesser horn of hyoid bone, greater horn of hyoid bone, the epiglottis, the thyrohyoid membrane, the notch for the superior laryngeal vessel and internal branch of the superior laryngeal nerve, thyroid cartilage, thyroid gland, and the vessel, superior thyroid artery, thyroidema artery, and inferior thyroid artery, right? So thank you so much for watching. Subscribe for more.